Good morning. Welcome to the Calhoun County Board of Health meeting. We're going to start this at, looks like 10:05. Thank you all for coming. First order of business is to review the minutes. Minutes have all been sent out a couple weeks ago. I'd entertain a motion to accept them.
Go ahead. I'll move.
Commissioner Rader says to accept the minutes. All in favor? Say
Aye. Aye.
Any opposed? No. Okay. Minutes are accepted. All right, the first order for the new business, we have a small presentation from Gina from the HHS about solid waste complaint response. Thank you for coming.
Okay, Gina James, Health and Human Services. I'm gonna try to remember how to, I'm gonna try to remember how to do this.
Might need it first.
Oh.
We had a few early technical issues, just getting some slides loaded.
Okay, okay, thank you. Okay. Okay, so we, looking at, for our quarterly update, we wanted to focus on one of our areas of work today. So we do a number of different things in Health and Human Services. And today we wanted to talk a little bit about our solid waste regulation. So we have a couple of different components related to solid waste regulation, like permitting solid waste facilities. What we wanted to talk today about is what happens when we get complaints and how we address that. Just to start off, this work falls under the Board of Health, and through our health officer, it falls under some of the duties to take action to maintain health and sanitation in our community, control and prevent spread of dangerous or infectious disease, and prevent, control, or abate nuisances detrimental to public health. Public health being the key word in terms of when we are addressing these issues, and we'll talk a little bit more about that. We also have a county code related to solid waste management, so a lot of this work falls under the purview of that. So what is solid waste? So the definition within our code is all putrescible and non-putrescible solid and semi-solid waste. Most often what we see is garbage like food debris, tires, old furniture, clothing, mattresses, those types of things is what we most often see in terms of solid waste. How does HHS get involved? We receive complaints. And so just want to clarify, we are not driving around looking for solid waste issues. We receive complaints. They can come in via a telephone call, an email. We have an online form. It could be someone that stops at the counter. So basically, any way you can contact us, we can take your complaint in. And then from there, we will, our first step is to verify the complaint. And so, we get a lot of concerns brought to our attention. They are not all concerns that we're able to address. And so that's our first step, is to verify if it is a solid waste issue that we are able to address. And again, we're looking for that public health risk piece. So our first step is to do a drive-by from the public roadway. So if we can see the property from the public roadway, we will drive by and take some pictures, again, looking for the public health risk in that. So, things, people are allowed to have all kinds of things on their property. And sometimes described as eyesores or things like that. People are allowed to have things on their property. What we would be concerned about is if it is posing a risk to public health, where something is, creating issues with vector control, if there's, those types of things around, if there's leaky hazardous materials, that type of thing. So those would be things that we would be looking for. If we're not able to verify the complaint, and that we might do outreach to the property owner or the complainant. It's often a nearby neighbor. Sometimes they'll give us permission to come on. And so we'll try to do what we can to do our due diligence to make sure there's not a public health issue with the solid waste. But if we just can't verify it, or if we drive by and don't find anything, or we talk to the property owner, go on site, and there's not an issue with solid waste, then we will close the complaint at that time. If it is verified, then we move on to contacting the property owner, and we set goals for cleanup. And so what that can look a lot of different ways depending on the scenario and what we're looking at and the amount of items. But we'll kind of go through with the property owner what we're concerned about in terms of public health risk, and talk with them about ways they can address it and clean it up. And then we'll, like I said, we'll set some goals and create a plan for that cleanup and what that looks like. Most often what we see is voluntary compliance. And so, like I said, we'll monitor the situation, monitor progress, go back and make additional site visits. If we set a goal of addressing a particular area on the property, then we'll go back and confirm that they've addressed that particular area. Maybe then they're moving on to another area, and that would be the next phase. Most often, we do get some pretty good voluntary compliance. If we're not seeing that progress and that cleanup happening, we can move to issuing citations, and we work with the courts, and that's a fine process. Like I said, most often we see a lot of great voluntary compliance in those situations.
Gina, is that, when it gets to the point where it's a fine deal, is that under, can HHS says we're doing a fine, or does the prosecuting attorney say, yeah, we'd support a fine here? Or who has authority to actually say, hey, we're going to fine you? Does that rest with you or rest with them?
We do. So Carol might know a little bit more about the details. Let her come up.
Good morning, Carol Harrison, Health and Human Services. We don't issue the actual citations. We actually used to, but we don't any longer. I believe our partnership with the Sheriff's Office, they help us on those. We have a deputy that we pay a partial piece of his salary, so he helps us with those, and then it goes through the court system like any other citation would.
Okay, thanks.
You were just asking for a friend, right? Right.
Yeah, yep. Asking for.
Yeah. So that's kind of the process that we go through. Like I said, most often we get that voluntary compliance, and we're able to work through that with individuals. And we see them, working on cleaning up and what that looks like. And again, they all look very different. And so what we are looking for and monitoring is the solid waste that may be having an impact on environmental or public health risk. And so it could be that we close a complaint and there still may be some stuff about, but those items may not be posing a risk to public health or the environment. So I just want to make that clarification. And then we have some pictures to show. So this particular example, this one has 2 before pictures. This one's in progress. And so this was when we received the complaint, and we went out and on the public roadway, took some pictures of what that looks like. And so you can see tires and garbage and different varying debris on the property itself. Let's see, we have one more here. So here again, you can see some garbage cans and some things filled up and piled up. So as I said, this one is in progress. And so This is a slightly different view, but you can see some area has been cleaned up. There's still some work there in the back by the structure, but like I said, it often is like identifying a section and kind of working our way through and working with the property owner on what that looks like.
So if this was on a private road, would you have any jurisdiction?
So again, we sometimes will reach out to the property owner, or often the complaint is coming from a neighbor. In some cases, the neighbor has said, yeah, come on site, come on my property and come see what we're looking at. And so sometimes it happens that way too.
How about a county road? Rural, not in the city.
So
It's
yeah, county road.
not private property, just right off the side of the road.
Yeah, oftentimes that is what it is just off of the public road. Yeah.
So that's for you guys too.
Yeah, we could go and look and we'll drive by and see what we can see from the public roadway. Mhm.
So I have a question. You mentioned determine whether it's a public health threat,
Mhm.
right? So, and you don't need to go into detail at all on about this, but I'm assuming then that you must have a cause and effect list of what would be considered a public health threat. Like you mentioned, vectors. So obviously, if there's garbage causing a lot of standing water that could breed mosquitoes, yes,
Mhm.
public health.
Mhm.
But I'm thinking in my brain is thinking about tires, okay? Tires that just accumulate. Is that a public health threat or an environmental threat? So I'm sure you must have some sort of algorithm,
Yeah.
something that you use to determine that. Is that correct?
We have some of what we see as like the most common, and there's some that are very clear, right? Like you said, public health issues. And sometimes there's, piles of oily rags that are getting rained on and it's going right, not in any type of container and it's going right into the ground and things like that. If we get into those situations where it's more of a gray area, we certainly would consult Dr. Krager and talk about what that looks like. This is what we saw. This is, it's a little bit of a gray area. And we would talk through that with Dr. Krager and may involve legal at some point too, just to make sure we are on
And
the
the,
same
the
page.
tires is a big deal. Like you said, the water pools in those tires and causes, mosquitoes and everything. So we try every year or so to work in partnership with WSU Extension and the Department of Ecology to host a tire event. We've done them out at the headquarters landfill under that big kind of shop structure before, and we collect thousands of tires. And lots of times those folks have a special invitation to come. So we might be working with one of these properties and we'd be, hey, we're having a tire event next weekend. Here's your personal invitation. And because it's free and they don't have to pay to just get rid of those tires. So
Great. I appreciate that answer. And what it did for me, thank you, is connect the dots. Okay, how does this tie back, Dr. Krieger? So perfect.
Yeah.
Thank you.
Yeah, you're welcome. Okay. Our next example, we have two before pictures. So you can see this is kind of an aerial view of a property. This particular one has quite a few motorhomes, which I'm going to touch on just briefly. The same with vehicles. Those items, then and of themselves, may not be a solid waste complaint in terms of looking at public health risk. Again, people are allowed to have these things on their property. What we would be more concerned about is what kind of condition is it in? Is there parts to it that are leaking and exposed and that kind of thing? Or is there garbage piled inside of, those types of things? So I just want to make that clear distinction. Having a vehicle on your property is not necessarily a solid waste complaint. So this is an aerial view of this property, and you can see, we're going to do another, this is kind of zoomed in, so you can see quite a bit of garbage and debris scattered around this particular site. Maybe some old appliances, things like that.
and I want to mention, we don't have a drone. These photos, I believe, are compliments of the sheriff's office.
Okay, so then our after picture here, you can see there was quite a bit of cleanup that happened on this site. A lot of the garbage was removed. Again, there's still a couple motorhomes, which may be perfectly fine to have on site. And so, but really a lot of cleanup done there to get all of that debris and garbage picked up. So this is a great example of that voluntary compliance that we see a lot of the time. Okay, one more. This is a before picture of a site. And quite a bit of garbage you can see stacked up there around and overflowing in containers and different things, maybe also some appliances, things like that. And then this is the after. So quite a difference there in what was cleaned up. And so that's, again, some of the work, and sometimes it takes, a month or two. Other times it might take a little bit longer depending on the site and how the property owner, how much progress they're able to do. But if we continue to see that voluntary compliance, and we work with them on what that looks like and cleaning that up. And again, it may not be everything on the property, but we try to make sure we're addressing all of those pieces that are that risk to public health or environment in terms of solid waste. We also address liquid waste complaints as well. I'm just going to mention that too, but most often those are related to our septic permitting work in that sense, sewage, proper sewage disposal and things like that. So they are different in that sense, but today we're just focusing on solid waste. So
That's pretty impressive.
Yeah.
What kind of conversation, what is that like? What's the conversation like? Are there like, hey, if you don't do this, we're going to do this? Or, because I could use that conversation for my kids in their rooms. That's pretty impressive.
yeah,
Call
me
Gina.
too. Me too. There's definitely some solid waste hazard going on in my older son's bedroom. Yeah, I mean, it really varies. Like I said, most often we're really lucky. I think we are able to have those conversations with people, and again, we're pretty reasonable about it. As like I mentioned, it's people can have things on their property. We just want to make sure we're looking at things that are, yucky and oozy, and want to make sure we get those things cleaned up. And so a lot of times people are open to that. And, it's to our benefit that we're able to make a plan, and we make a plan that they agree to. So again, that can look very differently. And sometimes it doesn't happen as quick as folks might like it to, but in terms of getting an area cleaned up and achieving that voluntary compliance and working with the property owner and having, a good relationship with them, so they are wanting to, clean it up and work with us. Most often it's a okay experience in terms of doing that with somebody, so.
And I think there's a lot of different scenarios too, like it's not always just the property owner let stuff piled up. Sometimes it might be, dad's house and dad passed away, so the family has to take care of it. Or you might have landlord tenant where there has to be an eviction process. So it can vary on that level as well.
I think one of the things that stands out to me is there's a difference between aesthetics and public health threat. And, I think that that's important to address that with people, and it sounds like you do that.
Yeah, it is important. Like I said, people are allowed to have things, and what we might like to look at may not be what other people like to look at. But as long as it's not, creating issues that go beyond and start affecting neighbors and things, then they may be able to have those things, so.
Maybe that's the way to approach teenage bedrooms.
Well, thank you very much for the presentation. Anybody else have any more questions for them? Thank you. That cleaning some things up. Yeah, I think it's important to have your county clean, both visually and for sanitation purposes.
So were all these cleaned up by the landowners?
Yes.
Yeah.
Yeah, we don't know. That's another good point. We don't do any of the cleanup ourselves. It's all just working with the property owners. And they'll, and sometimes they'll clean up, they'll do a dump run. They might bring us the receipts and say, look how much I got rid of. And then at our next, site visit, we'll go and verify that. So yeah, the property owners do all of the cleanup themselves.
Do you see people, once they get to this point, do they go back to what it was before often, or do they maintain it?
Yeah, I think that that can happen. And like, as Carol mentioned, there's a lot of different scenarios. And so, sometimes where there's individuals that have some different challenges and, like to keep a lot of things. And so we may see that build up again over time. And so, then we may get involved to get another complaint and go back out. And hopefully, maybe we've come in earlier than the time before and it's not as much or not as big of a pile. So yeah, that can happen.
Depends on how many teenage kids they got.
True.
Okay, thank you very much again.
Yeah, thank you.
Next up, we have some health officer questions. Dr. Krager is here. Thank you for coming. I spoke with a few constituents and there's been a lot of news on some of the subjects. And so we asked a couple questions to Dr. Krager. There were several questions, but for today, we're just going to try and address two. And Dr. Krager prepared a couple slides for us to look at. The question I asked the first one was the federal government has recently indicated there seems to be a link between pregnant women taking Tylenol or acetaminophen and that causing autism or other problems. This was based on a Harvard study that had come out in August this year. It was a large study, and I asked Dr. Krager what advice would he provide for the women of Cowlitz County. So thank you for coming and talking to us.
Thanks, Kelly. Yeah, so Steve Krager, I'm the health officer for Cowlitz County. I'm happy to be here to answer these questions because I do know people are curious about them. And I think there's just generally confusion, so hopefully I can clear a few things up. So I appreciate the opportunity. Okay, how do I do this? Sorry, I'm trying to figure out the slide thing. I'm trying to, it's not working. Up, down, oh, I got it. Okay, I got it. Slide up. Wait. Aha, okay, so yes, here's your questions, Kelly, that you sent me. And then the second one we're gonna cover is what about vaccines, and the question related to autism. Okay, so regarding acetaminophen, and this is gonna be, oh shoot, it kind of, you can't see it very well, unfortunately. Let me see if I can zoom. Oh, that the what I was trying to highlight got completely blocked out. Okay, so regarding acetaminophen, just the first thing I want to start with. This is from the FDA shortly after the government kind of made these announcements. This was the actual guidance from the Food and Drug Administration about what this potential link between acetaminophen and autism and ADHD. I think Bailey's gonna. Thank you. Okay, perfect. So they talk about that. This was a letter sent out to basically all physicians in the country. And what bothers me a little bit is that it seems like sometimes we get contradicting statements. So I do think it's really interesting to look clearly what the FDA is telling physicians, which is I highlighted. So they talk a little bit about the studies that show a link, but then they say very clearly a causal relationship has not been established, and there are contrary studies in the scientific literature, ongoing research. And this is the part that I think is really important for practical take-home messages. Clinicians should consider minimizing the use of acetaminophen during pregnancy for low-grade fevers, but balanced with the fact that acetaminophen is the safest over-the-counter alternative in pregnancy among all analgesics, which is an antipyretic, so pain medicine and fever reducers. Aspirin and ibuprofen have well-documented adverse impacts on the fetus. So that to me is kind of is the take-home message. We should be cautious, but acetaminophen is still our best option. And I'm going to go over a couple studies, including the one you sent me from Harvard, and talk about just weighing the evidence a little bit. So let's go to the next slide. And I know I have a number of slides, but I'm pretty sure we'll be able to get through it quickly. Okay. So up to 50% of pregnant women use acetaminophen, also known as Tylenol. And there are some links, both with autism and ADHD, that have been shown in some studies. But there's conflicting research. So I'm going to talk about it and kind of what we do with that. Let's go to the next slide. This is probably the most important thing that we do in epidemiology, is figuring out what's a connection, also known as a correlation, and what's a direct cause. So connection, correlation is two things happening together at the same time. An example of a correlation and not a direct cause is ice cream sales and drowning deaths both increase in the summer. Those lines are basically, perfectly correlated. But we know that one of those is not causing the other. One thing we have proven over time and with lots of studies is smoking causing lung cancer. So the critical point is that there's this hidden factor, which in this case is hot weather for the ice cream and the drowning deaths. So there's this thing called a confounder. I'm just going to call it a hidden factor. It's something else that creates this false kind of connection between one thing and another. There was a period of time, 80s, early 90s, where we actually thought drinking coffee was associated with pancreatic cancer because there was a clear connection. People who drank more coffee also had higher rates of pancreatic cancer. And then when we did better research and looked at other hidden factors, found out that coffee drinking, especially at this time, was strongly associated with smoking. People would smoke, have a cigarette, and drink their coffee in the morning, and that was a pretty common practice. So the actual direct cause of that increase in pancreatic cancer was smoking and not coffee drinking. All right, let's go to the next slide. But these are things, this is confusing, right? When we do this, we find this connection. It's not always clear what the exact cause is. So when trying to find a direct cause, there's a few different ways. We can look for those hidden factors. That means we call controlling for it. So adjusting the data to make sure that that hidden factor is accounted for. Sometimes we do like sibling comparison studies. So we're looking at people in the same environment, but let's say one was exposed to one thing and the other one wasn't. And then at least we have, those shared environments and most of their genetics are the same, and then we can get a better comparison. Sometimes we just need to understand how something happens. Just because there's a connection doesn't mean it makes sense that there's a connection or that would actually cause an effect. And then a lot of times we need consistency over time, repeated studies reaching the same conclusion. So let's go to the next slide. Oh, just as the FDA letter pointed, and I'm sorry that this is not very easy to see on the screen, but the other caution that I have for pregnant women is the other medications we have for pain and inflammation have lots more side effects, especially for fetuses. So ibuprofen, which is known as Advil or Motrin, Aleve, aspirin, are known as NSAIDs, and we know significant harm, kidney problems, low amniotic fluid, heart problems, preterm birth, all these things are associated with those medications. So we don't want pregnant women to be using those at all if they have pain. All right, next slide, please. Perfect, okay. So as our chairman mentioned, there was a Mount Sinai Harvard study that was kind of a congregating a number of studies and trying to balance them all and see kind of what the evidence weighed. So they did find, the higher quality studies that they had showed stronger connections, but those studies did not look for those family factors that we talked about. The best, go back one slide, perfect. I'm trying not to use like really strong judgmental language on studies, but I will say this this study that came out in April 2024 was generally much larger than those other studies, and they used sibling comparisons. So basically, some siblings had their mom took acetaminophen during pregnancy, and then during another sibling's pregnancy, the mom did not take any acetaminophen. And then they looked at, the risk between those two groups. Did the one sibling that was exposed to acetaminophen have a higher risk of autism or ADHD? And did the other one not? And all those connections that they've seen in other studies, they disappeared, which to me suggests that there's other factors at play. There's some other hidden things, and we know a lot of some of the causes of autism spectrum and ADHD. We don't know everything, but we have some good ideas. There was another pretty large study in the Journal of Obstetrics and Gynecology in February that showed no risk as well. So we have these kind of competing studies. What do we do with that? Let's go to the next slide. So we talked about this a little bit already, but these are things that could be hidden when we're looking for these connections. Genetics. So parents with certain genes are more likely to use pain medication and have children with neurodevelopmental conditions. You might have a risk. You might have a condition that causes you to take acetaminophen more often during pregnancy, and that might be linked to autism. And then we know that fevers, especially really high fevers, are sometimes linked to developmental issues, and people take acetaminophen for fever. All right, let's go to the next slide. So that's why I think this sibling controlled study is really helpful. Same family, obviously not every sibling is raised the exact same way, but most of the things that we can control for are going to share similar things. So when we didn't have those sibling controls in studies, there's that small increase in autism and ADHD rates. And I would note that even those tiny increases would not explain, it would explain a very small number of autism and ADHD cases. And then when we use those sibling controls, those connections disappeared. So to me, I interpret that, and it's not just me, it's, our societies of obstetrics and gynecology and pediatrics, that it's most likely that those original connections, due to shared family factors, were causing these connections, causing a confounder instead of this medication. So all that to say, let's go to the next slide. What does that mean? And this is kind of what I talked about. There's some studies that show connections. Better controlled studies, those connections disappear. We don't have a clear cause and effect. And there's probably other factors that make the most sense when talking about what leads to increased rates of autism and ADHD. There's still, as always with science and research in public health, we don't have a complete picture. There's probably more studies to be done about extremely high doses of acetaminophen. Maybe that is part of a risk. If there is a connection, we don't quite understand why acetaminophen in the body would cause this increased risk. So maybe there's more we can do to understand that. And then, in general, there's always more research to be done. Okay, let's go to the next slide. Let's try to wrap this up. Oh, we talked about this a little bit. If we don't treat fever and pain, there are potential risks. You release more stress hormones when you're in pain, and high fevers can cause certain risks to the fetus as well. Okay, next slide. Oh, medical decision-making requires balancing known risk. Can you go back one slide? I apologize. Okay, medical decision-making requires balancing known risks against uncertain ones. I think that's a really important point. Okay, next slide, please. So these are our options. So right now, this is what the FDA is saying, is that acetaminophen is still the the safest over-the-counter option. As with any medication that we give to anyone, you want to use the lowest effective dose for the shortest amount of time. And always, if you have questions, that's something you have for a provider. And then NSAIDs should not be used, especially after 20 weeks. But really, I would not use at any time during pregnancy. And then there's very rare cases where a low dose aspirin might be appropriate for a pregnant woman. Okay, next slide. Kept thinking I had this. Yes, so this is kind of what ties it all together. So for women in Cowlitz County, use acetaminophen only when needed. It's the safest over-the-counter option. Use carefully, lowest dose for the shortest amount of time. Avoid ibuprofen, naproxen. Talk with your provider. And then there's always other options for pain and sometimes for fever relief, including rest, cool compresses, stretching, that sort of thing. All right, next slide. Takeaways. Okay. Just because there's a connection doesn't mean there's a direct cause. Sometimes people will say correlation does not equal causation. And the best studies we have don't show that there's a direct cause between acetaminophen use during pregnancy and autism and ADHD. There's hidden factors that always matter in these epidemiologic studies. And then we're balancing known versus theoretical risks. So ibuprofen, we know, has risks for a fetus, and acetaminophen, ongoing research, but I think those risks remain unproven. And then everyone obviously has individual decision-making, and working with a healthcare provider is always your best bet. All right, next slide. Did I finish this? Here we go. Okay. I only have a couple more slides about vaccines and autism. I'm just going to go through them, and then if there's any other questions about these, we can talk about it all. So one of the questions that Kelly sent me is, do we see a connection between giving vaccines and autism spectrum disorder? And one of the links that was sent included a list of a lot of studies on PubMed that purported to show a link between vaccines and autism. I found this nice graphic. I wish you could see it better, but essentially it's most of the studies that have claimed to have found a link on the left, and then studies that did not find a link on the right. Let's go to the next slide because we'll talk about balancing this evidence, right? We have all these studies on the left, we have all these studies on the right. I think what's really important when we look at these things, people can, dump a huge list of links to studies, but the quality of that research really matters. So we've talked about some of these already today. Controlling for confounding factors is a quality of a high quality study. Using appropriate comparison groups, following established protocols, and then is peer reviewed and replicable so people can repeat your study. No study is perfect, but there's more flawed studies than others. If you ignore looking for those confounding variables, if you use mismatched time periods, it's just something called p-hacking, which I'm not going to get into, but cherry picking data often. And then sometimes we see studies that are bad enough that they're retracted by their journal. All right, next slide. So all those studies on that left side, claiming to show a link between vaccine and autism, about 2/3 were authored by these brothers named David and Michael Geyer. It's really interesting that, 2/3 of these studies came from the same authors. And unfortunately, they've been shown to have flaws in some of their studies. What's interesting is that almost all of their studies focused on thimerosal, which was removed from childhood vaccines in 2004. they've had problems, I guess is what I would say. They created an illegitimate review board of family members for one of their papers. They promoted kind of unproven treatments for autism. Um, Mark Geyer had a medical license, but it was revoked in 12 states. And then David Geyer was not a physician, but he was fined for practicing without a license. So there's problems with a lot of those studies. Let's go to the next slide. And this is what I see, unfortunately, a lot in, it's been happening honestly for over 20 years with these connections between, supposed connections between vaccines and autism, is that things are done backwards, where people have an agenda, they start with a conclusion, and then they try to find evidence that supports it. And that bothers me because it's kind of backwards of what we're supposed to do with the scientific method, which is ask a question, design a rigorous study, collect data, and then accept findings, and then try to repeat it. You know, what I see a lot in what I will call agenda-driven research is starting with that desired conclusion, you cherry pick outcomes, you ignore data that doesn't fit what you think, and then you only cite your work, your own work. So all of those studies that, a lot of them that showed, you know, supposed risk, the thimerosal focus is interesting because it's particularly misleading. It was removed from childhood vaccines in 2004, even though there wasn't actually a clear correlation, but that's a whole nother story. But we've seen, you know, autism spectrum rates continue to rise. So that doesn't really make sense as a reason for why that would fit. Okay, we covered a lot and it was very dense. I think that's my last slide. Can we check? Thank you. Okay, perfect. Any questions? Yes.
So first of all, thank you very much. I think that was very helpful, good review of causation, correlation, et cetera. And of course, I've been following the whole acetaminophen and pregnancy and looking at acetaminophen. And yes, it is one of our safer medications, particularly for pregnant women. One of the things that I'm sure the studies, and I have not delved into the studies in depth, right? I always love the abstract and the conclusion, and then the methods, they bore me. So, and I'm sure that the studies have done a lot of multivariate analysis with the data, because one of the things that pops out for me is the reason for the Tylenol use.
Exactly.
Right? So if the reason that this pregnant woman needed to take Tylenol was because of pain, maybe there's a correlation between the pain and the risk of autism, and not the Tylenol at all. That yes, you're right, that is correlation, but not causation. Maybe it's the pain that causes it, or infection.
Yeah.
You know, we're learning so much more about infections, particularly viruses, and the amazing long-term damage that they do, and we don't even realize it. So perhaps it's, if there's an infection process going on in that pregnancy, that's what actually is more of the cause than the acetaminophen, which just tends to be peripheral. So,
yes.
anyway, I very much appreciated your presentation. Thank you.
You're welcome. Yeah, those are great points. Like what an infection leading to a fever, right? That someone would treat, or whatever is causing that pain, right? Another condition or something like that. Yeah, those are really good points.
I'm one of those people that I believe that there's a strong link between who paid for the study and what the outcome is.
Sure.
And probably one of the grossest examples I could give you was, for how many years was the tobacco industry pushing tobacco as absolutely safe, there's no link to any problems.
Yep.
And they were standing up screaming and yelling when it was decided, Attorney General put the notice on the package that said it may cause cancer. And even then they were denying it, and denying that they were doctoring it up and making the tobacco stronger or more addictive, and then I would tell you, even the starting from the conclusion end is there a link? And working backwards, if it was a legitimate study and did the same process, they should come out with the same conclusion as somebody starting at the other end. I think if a study says, let's go study this drug and see if it causes your eyes to water, and that's the whole focus of the study. They're not studying it to see if there's a link to autism. They're studying it to see if it makes your eyes water. So I don't know what to believe or put my faith in anymore, because it seems like the science changes depending on who does the study and who does the focus, and what was the focus when you started.
Yeah.
So every time we turn around, there's a whole new set of circumstances and competing arguments about what was the scientific approach. I'm a firm believer that science says if you come up to a conclusion and you print the paper, then the next door neighbor or anybody else who's going to sit down and repeat your process, they should find the same results.
Yeah.
And if they can't repeat it, then obviously your conclusion was wrong. So I want to believe in science, but I don't necessarily believe the scientists that are doing this particular studies. So I don't know which way to turn about half the time.
Yeah, those are really good points. I think, you know, especially people are skeptical of pharmaceutical companies, right? Because they make vaccines, they make drugs, and obviously they want to sell their product. I think, you know, I can think back to medical school, and we were given a lot of kind of, you know, um, ethical studies on how to approach, you know, pharmaceutical drugs and studies, you know, done by pharmaceutical companies. And in general, we were always taught like, yeah, you should be a little extra skeptical of those, right?
Okay.
Sometimes, you know, we don't necessarily have other evidence, and so we're weighing things. But at least what I've seen, especially with vaccines, it's less true with pharmaceutical like drugs, but it's still true to an extent, is that there's often other groups doing studies as well. So a lot of like academics from all around the world that hopefully don't have those same influences and biases that, you know, pharmaceutical scientists associated with a pharmaceutical company would have. And from what I can tell, you know, especially with the vaccines and autism ones, the best ones are not linked to pharmaceutical companies. They're done by independent researchers. So that's something you can always try to look for, right? Is that, yeah, is there bias in this study? Who is paying for it? I think that's always appropriate to do.
I'd just like to add, just this morning, I saw an article that the state of Texas has now launched a lawsuit against the pharmaceutical maker or the maker of that. But I want to say that I appreciate your answers were very detailed, and I think that it's the job of this board that if there is a concern, if there's some doubt, if we're not sure, to just raise the awareness.
Sure.
And I really appreciate your answers on that. And I think we covered that pretty well. We still don't know the answer yet, and that time will tell, just like you said with the cigarettes. But I think just to raise awareness is, at least that's my objective.
So speaking of raising awareness, there's some great studies that have just been done about the shingles vaccine, herpes zoster vaccine, and amazing benefits that were unanticipated from that. A 25% reduction in cerebral dementia, so a brain disorder caused by blood vessel problems, right? Instead of Alzheimer's, but kind of the same category. So I'm really curious to just follow those, because speaking of awareness, we should be telling everybody over the age of 55 or 60 to get that shingles vaccine. There you go. I put in my promo.
Should I get a double dose?
No, I'm pregnant.
Any other questions? Thank you very much again, Dr. Krager.
Of course. Thank you for
Thank
your
you.
time.
Excellent.
Okay. Last just a little bit of business is, the meeting for the next month. Where's my notes? Here. Instead of, November 25th, the Board of Health meeting, it's so close to Thanksgiving. I thought we would move it, and the clerks have given us a go-ahead to move it to December 2nd. So December 2nd will be our next Board of Health meeting, and so nothing in November. And, I'll open it up to public comments at this time. We have any?
Thank you for the opportunity. At last week's Board of Commissioners meeting, appointments were made to the Great Rivers Behavioral Health Advisory Board. How does this integrate with what you're doing with this board, or is there duplication or synergy, or what's the position?
That's the first I've heard of it. So,
I don't think that there's any overlap whatsoever, really.
They have
Being that I sit
completely
on both of
separate
them.
beneficial charters?
Say that one more time?
They have completely separate beneficial charters for us as a community?
Yes. Yeah, they're not, I don't, Gina, you could correct me if I'm wrong, but I don't think there's any overlap really in what we do and what they do. Yeah, there's
what
not.
do they do?
It is a consortium of 5 counties that have come together to delegate funds for behavioral health services within the 5-county district. Yeah.
Okay, thank you.
Any more comments or questions? Okay, with that, we'll adjourn the meeting at 10:57. Thank you all for coming. We'll see you in December.